Pneumonia is an infection or the inflammation of your lungs. It happens when your lungs have got in contact with some germ that it hasn't had before. You could get infected because you've had previous contact with a virus or a bacteria. Also, you could have just gotten over another sickness and your immune system is weak. You could have some kind of illness already, like diabetes or chronic bronchitis. There's a possibility that you could have breathed in the fluids inside of your stomach. Or if you've recently had surgery and gone under anesthesia, you could have pneumonia. Symptoms for pneumonia include a fever. They also include chills, a cough. You could have a shortness of breath, chest pain. If you breathe in deep, you could feel pain. Coughing up things from your stomach. You could have muscle aches. Not all pneumonias cause fever. The only symptom for several days or weeks that you could still have is a dry cough, or often you're really tired. For older adults, the early sign of pneumonia may be confusion, or they just not want to do any physical activity. Pneumonia is diagnosed by the doctor. Will do some tests. They'll look at your symptoms. They'll see if you have a fever or if you're having any breathing problems. They'll take their stethoscope and they'll listen to your lungs. There's a possibility that you may need an x-ray. They might do some blood test or some tests on anything that you cough up. Then after the tests are done, your doctor will determine what's the best antibiotics for you. They'll give you ways to take care of yourself at home. If the pneumonia you have is caused by a virus, the antibiotics will not kill the virus itself. But it's not really determined if pneumonia is bacteria or a virus, so the doctor will probably give you an antibiotic anyway. If your symptoms are mild, you may only need to rest, drink fluids. You might still need to go to the doctor, but might not. Depending on how severe your symptoms are, you may need to stay in the hospital if you're having trouble breathing, if you can't drink fluids, or if you have no one at home to take care of you while you're so sick. Also, if you're hospitalized, they might give you oxygen or IV. The nursing staff will come and observe you and check up on you, and you might also have several x-rays done. If the pneumonia you have is caused by a bacteria, then you should start to feel better within 2 to 3 days after you start taking the antibiotics. If you're a healthy person, you should start feeling normal after a week. But if you're over 65 or have any other medical problems, it might take you a little bit longer to start feeling healthy again. If the pneumonia you have is caused by a virus, you should feel better in just a few days. It shouldn't last that long. Start the medicine right away and follow your doctor's orders. You should always rest until you don't have a fever, or if there's no chest pain, or if you have shortness of breath, you should try to rest. Make sure to follow your doctor's instructions. They'll let you know when you can go back to doing your everyday activities, such as going to school and your hobbies and work. Make sure you drink lots of liquids, water, tea, fruit juice. All those things are really good for you to help you cough up more easily. You should try to cough up anything that's stuck in your chest. If you want, you can use a cough medicine if your doctor recommends it to you. Ask your doctor about taking any aspirin or ibuprofen for fever or chest pain. You can use the heating pad at the lowest setting for any chest pain you may experience, but make sure you don't smoke or drink while you're recovering. If your symptoms are getting worse, you should call your doctor within the first 2-3 days. One way to help prevent pneumonia is don't smoke. Every October, you can go and get your flu shot. That will prevent you from getting flu, but can also help you from catching pneumonia too. There's also a pneumonia vaccination. If you have a chronic illness or are over the age 65, it's recommended that you get that vaccination. If you're an adult over the age of 65, you should get a second dose. If you've already had the shot, every 5 years you should go and get another shot. Make sure you eat a healthy diet and make sure that you exercise according to what your doctor suggests to you.